Today we'll discuss two common elbow problems, the tennis elbow and golfer's elbow. Elbow tendinopathies are some of the most common causes of elbow pain, most often affecting the extensor carpi radialis brevis origin on the lateral side and the flexor carpi radialis pronator teres origin on the medial side. Prevalence is higher among the workers performing repetitive tasks. Although some have proposed an erogenic origin, etiology is not well understood. Diagnosis, diagnosis is most commonly made by clinically utilizing point tenderness. The patients will have point tenderness on the medial epicondyle or the lateral epicondyle of the elbow. Nerve compression can coexist. Ulnar nerve or a radial nerve compression can coexist with a tennis elbow or a golfer's elbow. A large number of non-operative treatments have been described. The most common non-operative therapies involve the physical therapy, bracing, splinting, corticosteroid injections. In addition, studies have investigated the phototherapy, plasma-rich injections, autologous blood injections, botulinum injections, and extracorporeal shock wave therapies. One study published in Journal of Bone and Joint Surgery 2013. In that, they studied injection of a platelet-rich plasma, steroids, or saline produced a similar pain and disability results in a lateral epicondylitis. The conclusion of the study was that in a patient with the lateral epicondylitis, an injection of PRP, corticosteroid, or saline did not differ in reducing pain or a disability at 3 months. Operative intervention in tennis elbow or golfer's elbow. Operative intervention for the lateral epicondylosis or tennis elbow or golfer's elbow is typically offered after failure of conservative measures and can be performed with open or arthroscopic procedures. There is a one study published in 2008 in the American Journal of Sports Medicine. 10 to 14-year follow-up of a surgical technique on lateral epicondylitis. They do surgical release on patients and they follow for 14 years and the level of advance is 4. 92% of the patients reported normal elbow range of motion. The overall improvement rate was 97%. The patient satisfaction averaged 8.9 out of 10. 93% of those available at minimum of 10-year follow-up reported returning to their sports. Similar treatment methods have been reported for the medial epicondylitis or a golfer's elbow, but release of the flexor pronator origin without repair may result in weakness in athletes.